Okay, moving right along, looking again and in more depth at hormonal regulation. So the names of the hormones here: growth, thyroid, and testosterone and estrogen. The growth hormone is going to be the one that stimulates the epiphyseal plate activity in infancy and childhood. The thyroid hormone regulates or modulates the activity of the growth hormone. So this has to do with how much and where the growth hormone is activating bone deposition. Testosterone and estrogen are coming in strongly at puberty, and they also are going to be the ones that are responsible for ending the growth and inducing the epiphyseal plate closure. So we need a balance of this, and too much or too little of any of this will lead to abnormal skeleton growth. So the growth hormone, again, is going to increase the activity of cartilage underneath the periosteum. The activity of the cartilage increasing is going to allow for more bone deposition. So the disorder that comes up in children could be inadequate growth hormone or excessive growth hormone. Inadequate, we see pituitary dwarfism, and in excessive, we see the pituitary giant. Here we have someone who is very short with normal proportions, and here we have someone who is very tall, also with normal proportions, sometimes enlarged heart. So, okay, so the pituitary dwarf, normal, and giant. So I love this image here. Here they are hanging out and having a good day. So the pituitary gland is the master gland, which is going to regulate the control of the growth hormone. So, so that's why, although this is about growth hormone, although this is about the amount of growth hormone, it's referenced with the pituitary gland because it's the master gland. So here we have two twins, and one is the pituitary giant or had excessive growth hormone. We'll take time here. So normal hand, the larger hand, the normal foot, and then the larger foot, all due to that hormone. Here's excessive growth hormone after the growth plates have closed. So here we see enlargement in the facial features, especially in the nose here. There's also some tissue as well that's deposited and looking like just overall greater or bigger features. Here's a hand. The name for it is spade hand, right? And again, it's just going to be this person's going to grow or have bone deposition and enlarge and grow after the discs have closed. There's still going to be bone growth. Here's achondroplasia. So this is something where it's a genetic disorder. It's not related to a hormone regulation during growth. Okay, so this is how someone would be born with the DNA that results in this pattern. So the difference here too is that you see that the person has short arms, short legs with a normal sized torso. So that's how we can compare or identify if this is something genetic versus something hormonal, when just by the visual encounter, right, due to those proportions. There's no endochondral bone formation or a failure of that, and that's what causes this. There's also a poor organization of the epiphyseal cartilage, and that organization matters, right, to get the right proportions for the bone growth. So yeah, so I want to look at, I want to just tell you one thing clinically about, before we get into fracture, clinically about growth hormone is that there are medical interventions for regulating growth hormone with these pituitary giants or pituitary dwarfs now. That's something that you might come across for interventions. Okay, we'll pause here before fracture.